Welcome, everybody, and thank you for joining us today for the AHRMM's third Healthcare Supply Chain Response to COVID-19. This is a provider panel discussion, and it's being hosted by AHRMM's Learning Community. I'm Dee Donatelli. I am currently the Vice President of Professional Services at Track Manager and have the privilege of serving as AHRMM's 2020 Board Chair. And as you can all guess, it's been quite the year so far. Today I will be moderating a session, and just a quick note for those of you who might not be familiar, AHRMM is a national professional association. We're dedicated to providing education, leadership, advocacy, specifically in the healthcare supply chain space. Throughout this COVID-19 pandemic, AHRMM has been working very closely with government agencies, healthcare leaders, and professional organizations across the country, as well as our GPOs, distributors, manufacturing, to try to provide the most up-to-date information and resources possible to our membership and the healthcare supply chain industry in general. I would like to take a moment. I would be remiss if I didn't shout out to Mike Schiller, who has come back to AHRMM the beginning of this year. Thank goodness he has, and he has really served as a tremendous advocate for the association, a resource for the American Hospital Association, and is making a huge difference for the membership that we're serving. Just real quick, some housekeeping items for the call today. All the lines have been placed in listen-only mode, but please use the questions and type in the Q&A box. I'll be watching those, and I'd like to bring them up to our speakers today as we can. Just at the bottom of the WebEx browser, click on the icon. There's 3 dots. You can put your Q&A in if it's not popped up on your screen already. As a reminder, AHRMM will be developing a takeaway document after these sessions, and we will de-identify any questions or feedback and then provide that overall to the healthcare community. So moving right along, I'm excited today to welcome 2 of the board members of AHRMM. Both of them are from leading healthcare organizations in the country. Andria Davis is the Director of Supply Chain at Onslow Memorial Hospital, and Regine Villian, as we all know, is the Chief Chief Supply Chain Officer at Oschner. So thank you both for joining us. We're going to put a polling question up, and while we're doing that, I want to give the audience a little bit more time to react to this, and then we're going to come back and do some introductions. So as we're introducing our panelists, be thinking and answer the question on what do you estimate the percentage increase in your PPE has been from, say, January to March or to today. Give us that estimate. We're going to come back, and we're going to switch up today's call and talk a little bit more about the supply chain financial aspects that we are all facing, whether we were in a hot spot like Regine has been, or in an organization who are seeing a few patients but not nearly as many like Andria. So, Andria, why don't you start off? Give us a little bit of a background about your organization, what your experience has been to date, and then go ahead and comment a little bit on what you've seen percentage-wise increase in your PPE.
Great. Thanks, Dee and Regine, and thanks to the AHRMM staff. Thanks for having me. So my name is Andria Davis. I'm the Director of Supply Chain here at Onslow Memorial Hospital. We're an affiliate of UNC Healthcare in North Carolina, definitely a rural hospital. It's an interesting world, living a little out of everything. Regine is my hero, among many others. So I think we're, what I like to say, it's all scalability, right? We're all kind of doing the same thing, just many different scales. And we are seeing, just like others, a significant increase in PPE, not just purchases, but needs in a variety. So we're definitely in the 100 to 500% increase. I would venture to say just under about 4 times what we're used to buying, what we're buying now. So.
And Andrea, what have you seen from the number of patients, and give us a little bit of logistics about where you're located, et cetera?
Yeah, so great question. So we actually have only 39 positives in Onslow County, North Carolina, but we are delayed in testing and getting results, so we have to treat quite a few more than that as positive as everyone else is doing. So we're up to sometimes 7 to 11 days waiting just to know. So it's an interesting time for enduring while just waiting. A lot of waiting. That's what I've said the last 3 months have been, a lot of waiting. But we're waiting, 39 positives in the county, lots of patients under investigation. and a lot of coordination with our affiliate hospital systems to try and help and support them since they have a higher volume.
Perfect, thanks. So Regine, you have a very different story in New Orleans. You want to give us some updates?
Sure. Thank you, Dee, and certainly happy to be with Andria. I don't know about being your hero. You know, we're going to have to talk about that. But here, and happy to share some of what has been going on here in New Orleans. I'm sure you guys have been following the news, and New Orleans is, was a hot spot and still is somewhat of a warm spot. Even though we're starting to feel a little bit of the easing going on, but by no means, are we out of the woods. A couple of days ago, we discharged our 1,500th patient. So if I go back, I am Regine Villain, and I am the Chief Supply Chain Officer at Oschner. And Oschner is Louisiana's largest not-for-profit health system. And we have 16 owned and managed hospitals, about 20 affiliated hospitals, and 5 specialty hospitals, and oodles of health centers and urgent centers, across the state of Louisiana and neighboring states as well. So we have a large footprint, and in Louisiana, we have a very influential presence. And so, I guess because of that, we actually were one of the first people to see people come in with COVID-19 about 7 weeks ago. As I say 7 weeks ago, it seems like it was just yesterday, but at the same time, it also seems like it was like 7 years ago. So much has happened in those past 7 weeks. It's just been nonstop. I want to say firefighting, but it's just been nonstop, trying to figure out exactly how we can maintain the continuity of the operation, how we can support the caregivers and the patients, how we can maintain a safe environment for everyone. So it has been quite interesting, being part of the supply chain during this whole event in a city like New Orleans that has seen quite a few folks and at Oschner. So I'm sure there's going to be an opportunity to say a little bit more about that later, but I'll stop here.
Thanks, Regine. And so, the question that I have, I've seen and talked to a lot of people over the course of the last 5 weeks or so, particularly around, obviously, all of this, but a lot are talking about the substantial financial burden that either preparing for, and Regine, in your case, being overwhelmed in a hot spot treating of, and then kind of, Andrea, I would think in my mind, you probably did a great job on preparing. Now are you just going to stockpile? So, Andrea, give me some thoughts on that. Share with our audience kind of where are you at, particularly in supply chain, supply management of PPE.
Great, thank you. Yeah, I appreciate the vote of confidence that I did a great job preparing. We all like to think we're doing a great job. I don't know if anyone could have prepared for this and the way it happened. What I'm finding interesting from the financial burden perspective is rural hospitals, everyone knows, it's not a secret that we're struggling a little bit, trying to figure out a way to balance being lean. And I know in supply chain, we talk a lot about being lean and too lean or not lean enough. And with finances the way they've been the past few years, lean was a day-to-day, and I don't necessarily mean the continuous process improvement, reducing waste lean. I just mean lean in every sense of the word. And so when you would think if something like this happened that we'd be ready. And I will say my team does a great job in inventory management in place. We haven't run out of anything. So I guess in this 7 weeks, Regine, when you said 7 weeks, I could have sworn you had misspoke. Has it only been 7 weeks? Yeah, we've been doing a great job, but financially, where before it turned into just reduced revenue and watching to make sure we, expanded our service lines and made sure our clinics were up and running, urgent cares were up and running, everybody's doing that. Now it's, and cash was the big topic. Now cash is not the topic, it's operations, right? How are we going to pay for labor? How are we going to pay for supplies once we start ramping up elective surgeries again? There's a lot of what's next questions financially, and how are we going to get to where we need to be. And from just my perspective, when we're finally getting to a sustainable place, the favorite sustainable word, and then this happened. So we have a lot of questions, but there's great teams involved, and we have great partners. And of course, my colleagues across the industry have been a great help. So we'll get there. Just I'm not really sure yet what it's going to look like.
Yeah, I think that's probably how most of us feel. Regine, what kind of financial conversations are you having at Oschner?
Well, from the moment this happened, now I have to say that when I looked in my crystal ball back, I think at the end of December, beginning of January, when there were some conversations going on about this whole, COVID-19 situation. At that time, it was, local to just one area of the world. And not too many people were really thinking about that. However, I started to look at it a little bit differently in terms of supply availability. So back in January, I started sounding the alarm bell with my team and started to anticipate disruption in the supply chain itself. Not anticipating a pandemic, but in anticipating that this is an area of the world where a lot of our supplies are manufactured, and that likely if all those people were sick, that would mean that they would not be going to work in those factories, and that would mean that they would not be able to produce the PPEs and the items that we need. And so, therefore, we need to really take a look at this and start to ramp up. And I'm so glad that I had this conversation with my team really early on, because I think I was able to buy myself about 4 weeks, because we started to gather as a group around that time, and we were doing it daily and asking vendors and suppliers to help us understand what their pipeline looked like. Because somehow I could see that this was going to be an issue in terms of availability of supplies. Never did I think this thing would spread like this and then not only affect them, but affect the entire world. So I'm saying that to say that when this hit and our first patient showed up, I was not in a situation where I felt the crunch, because I had fortified myself a little bit in anticipation of not being able to get supplies. However, very rapidly, with all of the guidelines that were changing hourly, we realized that we couldn't just rest on that fortification that we had made, and that likely at that rate we'd probably be running out very soon. Right. And so we ramped up. We ramped up and started first with the vendors with whom we're working and the partners with whom we're working. We leaned on our distributor very heavily and asked them to really step in and work with us and enter into the arena with us, because in the area, again, Oschner being the largest health system, we are their largest customer in the area. And so we basically use that as leverage to say, hey, we need for you to work with us, and we need for you to stand right next to us to have this conversation. We also did the same with our GPO and said, we need for you guys to engage differently, help us open the doors with some of those vendors so that we can get our hands on PPEs and allocations. So at some point we had a dialogue around, we hadn't quite yet gone to the non-traditional sources, because I wanted to get my hands on as many traditional sourced items as possible, but very quickly, because we were flaring at the same time as New York was flaring. And so it was not, in a way, it was not a good thing, but in another way, it was a good thing. So we were basically competing with each other in terms of the regions. And so I started to then look outside of the traditional partners and started to see how I could source, through those non-traditional channels. And that's when, some of the shocks started to come in with some of those pricing that came in at first. And, I was just not wanting to pay those kinds of prices. So we did our best to work with traditional partners in non-traditional ways before we even went to the non-traditional, folks that were calling on us. So we try to mitigate that financial blow as much as possible, but we did end up having to jump in and dive in with at least some reputable folks so that we could at least get our hands on some PPE to get a bolus of items, because the rate at which we were using them across the entire health system was quite alarming. And we had to also work with our infection disease folks. We had to work with our physicians to make sure that we were influencing the decisions that were being made as well about the use of PPE. We pretty much at the beginning stopped this whole thing about giving a mask and N95 to every patient, every visitor, every person around. It's like, no, we're not doing that. We're not doing that. So it was really interesting to have those conversations, but it was a very intentional and very good collaboration in the way of working together to lessen the financial impact. But for sure, we certainly jumped in as well.
So great testimony to not only collaboration but partnerships. Andria, did you experience the same kind of partnerships and working with distributors, GPOs, so forth that Regine just talked about?
Absolutely, and I would like to call attention that, Oschner versus Onslow Memorial, we also tried to stick with traditional as much as we could, and I love what you said, Regine, about traditional and just non-traditional ways. That's exactly, we have had to do that since day one, because we did not have the checkbook, so to speak, to just get whatever we could in. We never went that direction, and we still haven't, and hopefully we won't have to. We wanted to work with our current partners. We found some new partners that maybe were partners with others that now, honestly, have become great supplier partners for us, and we plan on using them in the future for different things. Really, of course, the GPO support, constant leads. We spent a lot of weeks doing leads. But Regine made a good point in January. I don't know if anybody remembers, but we started getting messages about back orders and things like that towards the end of January. So you're right, Regine. It was that little bit of time where, okay, it's nothing's happening, but you know what? There's something, and it's interesting. That's why the 7 weeks feels like forever, because it's been much longer. But yeah. So the collaboration, back to the point, was GPO distributors. Of course, our distributor has been a great partner of ours. Love our GPO team. I would say colleagues from other facilities, other systems, of course, the system I'm affiliated with, that has been instrumental in sharing resources, just talking through things. What are you seeing here? And what are you doing here? And do you have an option for here? Especially since we've had to stay away from those non-traditional arenas, primarily due to finances.
I so appreciate what you said here, Andria, because I also want to.
Uh-oh, did we lose Regine?
While we're finding her again, I love that she brought up the working with infection prevention. I always call our IP and infectious disease, I always call our IP department honorary supply chain members, just because we work with them so often. But this collaboration and partnership during this has been truly amazing. And the voices and everybody getting a seat at the table and talking through these problems and issues and concerns and what's the best way and how do we communicate to this group of folks and how do we communicate to that group of folks. And it's been truly wonderful, wonderful teamwork.
That's great to hear. And speaking of hearing, do you guys hear me okay? I just had to switch to my computer.
Good.
I'm still there? Good. Okay. So let's move just a little bit. It was interesting because I think most everybody, we have about 50% of the people on this web call actually responded to that question. Most of them all agreed with you. Between 100 and 500% increase in their PPE on hand or financial impact. So I think that's going to be a pretty consistency that we're going to see across the industry. Let's kind of stay on the topic of PPE, but I'm interested, how much or what have you allowed in your hospitals to be brought in from home, or people in my community are making sewing masks like crazy and donating them. Is that something that you've used? And then the second half of my question is going to be, if so, how have you managed the cleansing and or have you gone to reprocessing? So Andrea, you want to start us off and then we'll move to Regine on that question?
Sure. Yes, so so I will say, I'll put a little plug here that as a supply chain person, you know, we don't get a lot of interaction with the community as far as community healthcare goes as often, except volunteer, of course, and things like that. But I mean, just in our general day-to-day, normally, I don't know if anybody else feels this, but if you said I work in healthcare supply chain, their eyes would kind of glaze over and they'd be like, what is that? And you'd basically probably say a generic, I work with supplies and equipment, or I buy supplies and equipment. But now everybody knows healthcare supply chain. So it's much more interesting conversations with the community. And so to your point, the community donations and support, the rallying of communities across the country and the world is just heartwarming. But we did not, to answer your question directly, we did not want to tell anyone no. We still aren't telling people no. We wanted to make sure, one, that if the community could get involved and help, then everybody was moving towards the same mission. But two, more importantly, is we didn't know how long this was, what was happening, what would happen. People right out the gate were wanting to donate and bring stuff in. So we did not tell anybody no. However, we have not had to implement or use any of the homemade or handmade donations yet. We have been able to give back some of our, not just homemade or handmade donations, but also clinical supply donations back to the community a little bit, nursing homes, homes for people in need, clinics that weren't affiliated with the hospital, dental clinics, so that they can get up and running again, hoping to, help the community as a whole. So we've been able to receive and give back, and just everybody coming together, homemade or otherwise, has been very generous, and we're very thankful.
Awesome. How about you, Regine?
I think she's being patched back in.
Yes, for whatever reason, I lost my landline connection. I know she was on one as well. So while we reconnect with Regine and get her answer, I'm going to invite our audience we're going to put up another polling question. And then we'll ask our panelists to discuss this. But is anybody thinking about or have moved to reusables, going back to gowns, masks, etc., that can be laundered? Is that something that the industry, we should or have thought about, or has anybody gone to doing that? So, Andrea, I don't think Regine's back on it yet. Well, I'm sure she'll let us know when she is. How about you guys? Have you had any conversations about reusable, or maybe in your organization, did you continue to use or have continued to use reusables?
Great question. So we have two things we've done specifically. We've done a few things, but two big ones. One, we had a local manufacturing plant that partnered with us, which we're very excited about, for half masks with N95 and P100 filters, but the masks themselves are reusable. So, and then the filters, there's no supply chain issue with them. There's no, they actually are produced about a quarter mile from the building as the crow flies. So we're able to, they partnered with us to begin with, but we're able to purchase as we need. And we were able to get basically reusable N95 masks with disposable filters. And that has been, and if I can recommend to anybody, and I'm willing to talk that through how the conversation should happen, but that has been a lifesaver. And they work the same as a regular 3M or whatever brand you use, N95, but what's interesting is the relief our clinicians feel that when they take it off, especially if you're following extended use guidelines per CDC or have COVID-specific units where they keep the mask on all day and then maybe take it off for breaks or lunch, they can actually wipe out the mask. It doesn't touch the filter. And then when they put it back on, they know it's been cleaned. And they can also be sterilized. So that's one reusable path we followed. Second one is we have gone to reprocessing of our N95s. We actually use hydrogen peroxide technology to do so. We have not deployed any of the reprocessed masks, however. We are just collecting and reprocessing. It's almost like our stage 3. We buy new, we follow extended use in our COVID-focused areas, and then the third step, if we can't get those two, is to use our reprocessed masks.
Interesting. Regine, you back yet? So, Andria, we'll keep on this topic. I was, just before we started this AHRMM conference, I was listening in on an AVAP, the Value Analysis Healthcare Professional daily chat. And Robin Lane from UPMC and Sue Toomey from Lehigh Valley have both moved to reprocessing partners. And we're talking about all of the protocols and all the changes in procedures. Now, of course, a lot of hospitals across the country have reprocessed for some time, but not in an emergent type or crisis situation. One of the things specifically relevant to masks that I found interesting was the use of makeup.
Right.
Working really closely with our clinicians, not only to get a program like this in place, have them feel comfortable with it, but for them to be able to follow protocol. Have you guys thought about or have anything in place in your hospital around those measures?
Yeah, great question. So we've partnered with our affiliate UNC Health, and they've done a lot of work in this arena too. But what we found in the very beginning of collections was we could only reprocess about 50% of the masks, almost exactly 50%. And the number one reason being makeup. And so, of course, there's no, in the reprocessing world, if you're in it at all, you'll know that there's no cleaning, so to speak, before the sterilization of there's the checking and the securing and all that, but there's no like real cleaning process. So there's no way to get the makeup out. So very quickly we realized that, okay, we're going to have to, the slogan is be brave, go bear. We're going to have to all be brave and go bear. And we are going to not wear makeup. So, it became a little tongue in cheek, the guys need to shave their beards and the girls can't wear makeup. And one of our senior team members made a joke and said, this might be difficult for us all, but let's try. Makeup probably is our number one issue for not being able to reprocess. So if you're going to do it, you gotta bring in wipes like we did and some other things to try and get people to be brave.
I was just going to say.
Hey guys, I'm back. I'm so sorry. The joys of technology was knocked out for a while, and trying to get back in was quite interesting. I don't know what happened. I apologize for that. And I was on a roll too until I realized that I was not on a roll because I was not on.
Well, we moved on.
And I could hear you guys, but I couldn't speak because I dialed from my other phone. If you don't mind, I just wanted to finish my point because I think it's an important point. The fact that others stepped in a big way as well was absolutely amazing and just inspiring. Even folks with whom we don't necessarily have a relationship, those folks jumped into the fray and just offered their help right away. So, and that's where what I was about to say is the power of networking and relationship really came into play. Because, not only our regular distributor, but the others as well stepped into the arena with us. And, other vendors with whom we have not necessarily done business, at least at Oschner, but people who knew me reached out and say, hey, Regine, I'm at the ready for you. I know things are hard over there. Can we help you? How can we help you? Foregoing the whole thing about, well, we don't have an official relationship with you and stuff like that. All that stuff went out the door, and people stepped in such a beautiful and powerful way that it was truly inspiring. And so because of all of those people on whom I was able to stand, on their shoulders and the strength of their organizations and their network, that also helped me, write this thing in a way that was completely different. Because, by all accounts, they talk about how we were an exceptional supply chain organization on Oschner, how we were able to get people XYZ. It's all fine and good, but I could not have done it without the support and the network of people around me and the strength of those relationships to bring me through this thing and, to bring me to it and really through it. So I just have to say that this to me was a huge, huge recognition as well, and a big part of how we were able to fare as quote unquote well as we did as well.
And your connections throughout the New Orleans and surrounding area communities, have you been accepting donations, PPE products in particular, Regine? And if so, how do you handle that?
Yes, we actually did because people just stepped in. People just wanted to help. It's usually what happens, and we see that the human spirit is such a beautiful thing when it comes to like those kinds of things. People just, even as they themselves were going through, hardships, everybody wanted to jump in and help. So we are, in a way, fortunate to have the chemical companies and those, the gas and oil companies that are over here in New Orleans, and they're like right along the river. Many of them just decided to give us, their entire lot of PPEs, because those folks are also highly regulated and need to also wear, particular PPEs. So those folks jumped in and provided us with pretty much their entire lot. And also folks in the community came in and jumped in and said, hey, how can we help you? Whether it's in terms of labor, whether it's in terms of helping to deliver, everybody put their, skills at our services. And with that, we were able to also quickly jump on the opportunity to do what I know many others have done also since. It's the whole self-manufacturing and local manufacturing as well. So we quickly jumped and pivoted to that and put our IO team and M3D lab together and basically started 3D printing and doing all those things with the community, helping us. But I just got to tell you, I was just so inspired with the way that people came together and just, offered their services and help. And some people came in and bought just a couple boxes of masks because that's all they had. Some small clinics, that were not necessarily associated with us. People who had some practices where they had a few gloves, people brought those in. And we basically opened a whole side of the operation to accept donation. And right now I'm in the process of making sure that I have all the names and gathering them, and I plan to handwrite a thank you note to all of those folks.
That's amazing. So, Regine, did it fall upon supply chain to actually vet the efficacy of the products that were being donated? How did you do that?
Yes, we actually, because I set up like a portion of my operation to take care of the donation because so many of them were coming in. So what we did is we didn't say no to donations in a way. We just, because people, like I said, people just wanted to help. So we just said, absolutely, here it is. We had a location where we had 2 people that were designated as the funnel for the donation. So those are the people taking the names and taking the items and things that were being donated. And then on the ground, when they brought them in, then I have a couple people on my team who were vetting through them and sorting through and figuring out what would work, what would not work. Now, there were certain things that were certainly medical grade items that we could use right away and pull into our own supply chain. But there were items that were not necessarily so, but we didn't discard them because we still have a whole population of employees who did not necessarily go into the facilities or, perhaps, visitors and stuff like that, because once we started to clamp down our visitor policy as well, then that also helped. But we were able to make use of the majority of the items and things that we felt were not necessarily appropriate. We've left them there, but we've provided them to some of our other providers, like, the food and nutrition folks needed some gloves and stuff. So instead of giving them the good gloves, we give them, some of the other gloves. And everybody wanted a mask. Everybody wanted this and that. Well, the masks that we didn't deem to be necessarily medically appropriate, we gave them to those folks. We gave them to the environmental service people. We gave them to some of those folks so that we made use of almost everything that was given to us because we recognized the spirit in which it was given. And frankly, we got to a stage, we never really crossed that threshold, but we got to a stage where it was almost like, okay, any glove will do, any mask will do, any protection will do. We thankfully did not get to that point because, like I said, our partners from near and far stepped in and really helped us and fortified us in a way that was just not even imaginable.
Mm-hmm. Right, and we had to do the same thing. We actually had to develop a tier structure. Our community was so great to us. And literally, you know, tier 1 is things that are almost identical or identical to what we currently use. Tier 2 is maybe very similar or similar use, but completely different brand. So that way we just get some quick education out. Third tier was things that have different use, but could be used for what they're doing. It just, the way they had to use it was different. And then of course the fourth tier was the any will do. So we ended up having to create a tier process and make sure to follow all the manufacturer's instructions and things like that. A lot of Googling, so to speak. But we were able to develop a structure to make sure the appropriate items were used in the appropriate place.
Well, and I'm seeing that on the screen. It's talking about reusable PPE, and so we certainly went there also very early. I think from week 1 or week 2 or early week 2, we started to have that conversation. It's interesting how, you know, I thought it was interesting how all of a sudden, you know, reusable was in again, and you know, cloth masks and cloth gowns were just becoming a thing again, and so that's what we did. We're fortunate to leverage our relationships with so many people in the industry and outside the industry to get people to come and help us with that. So one of our physicians, you know, has a contact in California who is, you know, getting ready to trial some copper infused, you know, linen stuff, and he said, hey, I'll give you guys a few. I'm not making those in high capacity, but I'll give you guys a few to try. So we've had those, and we've been trying those as well, and, you know, laundering them. And like I said, we pivoted to the community. In New Orleans, we're also fortunate to have, you know, a lot of those Mardi Gras costume making folks that are here, and a lot of those, you know, facilities are here, and we had tons of seamstresses that were outside of work because of this, and we just put everybody to work, brought them in, and showed them what we had, and basically we're able to create 2 different lines of gowns, one that is reusable and one that is disposable, and we also engage our linen provider and say, hey, guys, what can you guys help us with, you know, in order to get us to continue to go, because my goal was that we would not be in the news, we would not be one of those stories where people are wearing, you know, god-awful, you know, made PPEs. I'm not going to go there, but there were quite a few stories, and I'm like, no, we're not going to be those people. And so I will do whatever I need to do. I will turn earth and sky and bring out all the creative juices around to make sure that we can do that. So reusable has definitely ramped up quite a bit more. And, you know, there's conversations about the place of reusable now in the supply chain, and perhaps we diversify, because I think diversification is going to be a thing that we're going to be looking at as we look down the line. No longer, if you think about the vulnerabilities that we have all created by being so lean and so close to being just in time, and so close to being, you know, everything is just, you know, disposable, whatever, and we only had one way of doing things. Well, now we're starting to really rethink that. Is there a place where reusable can be in there? Perhaps a smarter, reusable form of product, but perhaps reusable is not such a bad thing after all, if you have all the right processes and stuff like that. So all of those conversations are on the table, and I just have to tell you, just in 7 to 8 weeks, I have pretty much really diversified, you know, the streams and the products that I'm using in the supply chain, because I just don't want to be in a situation where I'm relying on one type of thing and then, you know, being completely out and vulnerable.
I agree. And I think, you know, again, back to the human spirit that we've spoken of is the ingenuity and creativity. I want to go to a couple of questions that have come in. I'm going to pop up back a little bit too, as you both talked about non-traditional ways that we've partnered with one another, with our communities, with our suppliers and manufacturers. And so several questions have come in to say, you know, what are some of those examples? You know, in regards to going back to, you know, air quote, normal, you know, what are some of your thoughts regarding the access to manufacturer reps to, you know, beginning to think about extending or changing partnerships? Andrea, do you have some thoughts on that to kick us off?
Absolutely. So an interesting thing that I learned, and I probably should have known, and I apologize if this shows my lack of knowledge, but our prime distributors have authorized distributors. I mean, our distributors have distributors. And so what we have found is that some of those distributors either stockpiled or they had businesses that were buying from them, whether veterinary offices, that's a perfect example. And of course, they are all shut down or at limited capacity. And so they have stockpiles of supplies. So when our distributor wasn't able to provide or met allocation or whatever the reason, we weren't able to get any more of our products, we were able to call their distributors with their help and guidance and talk to people like that who, from a supply chain perspective, talk about so many more touches. And at this stage in the game, I was very grateful for them. But we were able to get to 3 or 4 different distributors of distributors who had stockpiles who weren't able to sell because businesses being closed temporarily that we were able to buy. And it was our exact product or just a plain substitution and no change of process, procedure, or efficacy. That has just talking to people and saying, okay, who do you know? Who do you sell to? Who do you sell to on a distribution level that you know is a distributor for others, and can you share those contacts with me? So that's been one. Another one I'd like to say is we had 2 interactions with veterinary offices. The North Carolina Veterinary Association, or whatever it's called, I probably butchered the name, but pretty much sent out a memo that said to all vets, please donate your PPE to hospitals. At some stage, about 3 or 4 weeks ago, the timeline's muddled, and all of a sudden, in like 2 days, we were getting calls from all the different vet offices. We have gloves, we have gowns, we have masks. Do you want them? And so it's back to the community and the response, and those are kind of non-traditional sources that we were able to get our regular, normal, traditional supplies in non-traditional ways.
Cool. How about you, Regine?
Well, very similarly, so we basically travel the entire continuum of supply chain with our partners. And like I said, when I'm saying partners here, I'm talking about partners with whom we had a contractual relationship with, and others with whom we did not necessarily have a contractual relationship, but a great relationship with. It's basically traveling the entire chain with them. So going up the line, just like what Andria said. So, okay, do you have access to somebody who does X, Y, Z? Oh, you know what? We didn't think about that. Yeah, let's do that, and let's connect that person to you. And let's make sure that we can look at it. So then you're finding yourself talking to, like, for example, bottles. Bottles became a thing. And I don't know, I think it's still a thing. Like, bottles are like liquid gold right now. You can't get bottles because a lot of people have pivoted to doing their own, hand sanitizers. Like for us, we've gone to the distillery plants around here to do hand sanitizers. So at one point, we're getting the hand sanitizers, but they're coming by the gallons. It's like, oh my gosh, this is not practical because I can't just put a gallon of something on the floor. First of all, people are just going to take it, and it's not really usable, very user-friendly. So it's like, crap, what do I do? Sorry, did I just say that? It's like, what do I do? And, you talk to somebody with whom you're doing business, but obviously you don't buy bottles from them. And it's like, you guys have those products that you usually put in bottles. How do you get the bottles? And it's like, oh, okay, I can connect you with so-and-so. So we traveled up their supply chain with them to also go and get bottles. And then bottles, it wasn't just bottles. I learned so much about bottles and tops. I could probably have a seminar about that. I mean, it's just not easy. It's not a bottle. It's a bottle and the thread and the this and the that and the flip top and the pump and the, oh gosh. You had to find your way to knowing exactly what you needed, but it was a good thing because we traveled up the supply chain with them and in a non-traditional way, because normally we would not be having that conversation with them about as close as possible to their processes and their raw products in order to help us get what we needed. So that's the kind of examples where the relationship just expanded differently, and where people started to also offer ideas about, wait a minute, I have this particular product, even though this is not necessarily for use, but it could be used in that particular way as well. And perhaps we can have a conversation with some of your clinicians and show them what, this is not something that's indicated for, but it could certainly be used in this particular instance. And so then, then had them talk to our physicians and stuff, and it's like, oh my gosh, yeah, let's try this. Let's try to figure out how we can use it in that way. So many wonderful examples of collaboration that just frankly we cannot forget, and we'll need to continue to build on and build, the kinds of oneness that we created during this whole crisis.
I certainly hope we don't go back to normal. I want to continue on this in a little bit of a side turn here. A couple of questions came in on vetting of, non-traditional suppliers. And as we all know, or should know if you don't, AHRMM's collaborated with GHX and using some of their tools and expertise to help vet non-traditional suppliers in this PPE space. So for those of you who may not be aware, there is on the AHRMM website and links to be able to look at the list of non-traditional suppliers that have been vetted to hopefully take some of the load off. But any tips or techniques that either one of you have used in all of these non-traditional suppliers that seem to be coming out of the woodwork these days?
Yeah, I'll take that one first. Definitely used AHRMM and AHA for that, and of course the GPO, they were a big help with that as well. I think you mentioned at the very beginning, we're very thankful Mike is back at AHRMM. Just a direct email saying, how do I do this? And he was able to help, but then it's out there for everyone. He just had to guide me, but that's been very helpful. I will say what I stumbled upon, and I'm sure others are stumbling upon, is they are one business name on all their information, on all the correspondence, on all the details, but the business name filed with the FDA and the government was different, and so we were stumbling through that. So definitely asking for the certificates of authorization of business activities in the United States became critical, but that first run through just to check through AHRMM and GHX and of course AHA that they were a legit authorized business dealer in the United States was my first go-to every single time. And then after that, we had, of course, hard stops, and of course, this is what I refuse to do or pay or coordinate with, depending on terms and conditions. I would either move forward with discussions or stop them, but that was a first look for sure.
Perfect. Regine, any tips?
Again, very similar to what Andria said, and I would just add to that. Basically, just first of all, anybody who sent me an email out of the cold and it was from, again, yahoo.com, gmail.com, I flush those out. Because, I'm not doing business with anybody who does not have an entity behind them. And then once I was able to hone in on a few, and I have to say a lot of them came through what I would call credible sources. Even though some of them came through credible sources were passed on from person to person, but I honed in more on those that people, talked about having a relationship with, people who had worked with those people, like a few of our board members recommended folks. And so you want to think that the board member, has a reputable and they have a vested interest in making sure that we're doing the right thing and doing business with the right folks. So some of those came through some of those channels as well, where even though they came through that, I personally made sure I vetted them. I vetted every single one of those non-traditional channels, me personally, before I even passed them on to the team, because I wanted to make sure to understand the strength of whatever organization or company or claim that they were making. And just like Andria asked them for a certificate of business and vetted them and looked up their names and stuff like that. And especially if it came from one of those sources that I talked about, then it was like, okay, well, yeah, I've done business with this board member, whatever. I'm their supplier for blah, blah, blah. So it's like, okay, well, at least I know I can deal with that. And then with that also, you could put some parameters and guidelines around the relationship, because we were early on. That when we started, we didn't really have those channels, those the portal with all the names that were vetted and stuff, that didn't exist when we started. You know, it kind of became a thing after probably third, fourth week of us being into it. So we had to do a lot of those vetting ourselves, but I was very particular about, you know, first of all, not going to just anybody, but also relying on people whom we knew. And then this whole idea that I want 100% of the money up front, it's like, go fly a kite. I'm not doing that.
Absolutely.
I don't know who you are. I'm not doing that. And guess what? If you don't give it to me, I'm going to find somebody else who's going to give it to me. I am not doing that, you know? So, yeah, I sent a lot of people flying kites. So if you guys saw kites flying, that was me.
I love it. Well, on that note, and I want to get a couple more questions in. We got a lot of questions, many of which for our audience, we will make sure we get answers back to you. There was a lot of questions around referencing or helping people find the reusable N95s and those kinds of things, which we can post. But two real quick follow-up questions, so brief answers on these ladies. Are you considering staying with some of those non-traditional suppliers, or do you believe that you will probably go back to a more, and I'm doing air quotes in my office, routine to your contracted suppliers for these products once the disruption is somewhat over? Regine, staying or going back, considering new partnerships?
Well, the only non-traditional partnership I'm really thinking about is building up on the local manufacturing piece of it.
Okay.
And that's really the only piece. Anybody else at this point, I'm not necessarily thinking about keeping that relationship, but the local manufacturing, the self-manufacturing portion of it, I'm definitely interested in.
Going to relook at. How about you, Andria?
Exact same answer. The local manufacturing, the local, those kinds of things, and rethinking how we're doing things locally. A few of those, especially for our big hot PPE items. But in general, I appreciate the support of the non-traditionals, but probably won't stick with a lot of them after.
Well, and this is just me, you know, several degrees removed, but I think that a lot of the non-traditional that flipped over and said, we're going to put on hold our normal manufacturing and produce PPE are going to go back to normal manufacturing again. So that leads me to my next question. With a relatively few minutes, what are you thinking about next? Are electives coming back online? Do you have supplies for those? Regine, you mentioned your crystal ball back in January. What's your crystal ball May 1st telling you?
Well, I'll just reiterate what I said earlier. It's going to be about diversifying our channels and optimizing them, figuring out ways to create redundancies in a way that does not create waste, but that creates at least, you know, some kind of reliability and a certain peace of mind in terms of being able to get our hands on the things that we need. So if I have to say it simply, that's the way that I would say it.
Okay. Andrea, how about you?
Yeah, my simple answer is kind of aligned with that exactly is, one, I want to make sure we have redundancies in place. So we have, I hate to use the word safety stock, but everyone on this call probably knows exactly what I'm saying, just a little more breathable room, especially if you are in a hot or warm area like Regine. Yeah, and also the moving forward, my crystal ball is we're starting to have meetings about what's next, a slow ramp up, not a open the doors floodgate situation, but ensuring that myself or my team is part of those discussions and being part of the plan, especially with IP's help. Making sure that we have all the data we can get, and especially future, what we're seeing coming in the future, and pipelines that we have already in place for the future so that we can sustain it. The worst thing would be to open up even small or little increments at a time and then not be able to support it and have to come back down. That would not be successful. So that's my goal, is to make sure that supply chain doesn't go back to the basement, that we continue to be part of the planning and the preparing and the being involved. And I jokingly said the basement. I don't think I'm ever allowed to go, in the basement again. So
I hope not. I think, and I do not mean this in any regards. I know you know me, the whole audience probably does not, but I really hope that we don't let this crisis go to waste, so to speak. I hope that lessons learned throughout this crisis, whether you were in a cool, warm, or hot spot area, are lessons that we can become a stronger healthcare supply chain. And I know through a lot of the questions, many of which we didn't get to in this 1 hour conversation, are talking about plans and vision for the future. You guys talked almost extensively on this hour about partnerships and networks and connectivity. How do we continue to break down those walls in a way that, I'm already hearing organizations saying, well, we're not so sure if we want to share that with others, or we're not sure what we can share. And I hope that we can break down that mindset so that the lessons learned can be shared across the industry and that we can make real strides in improving our supply chain. So those are my parting comments. Andria, your parting comments to our audience today?
Yeah, thank you. Yeah, I think you've said it the best, the partnership and the collaboration and the sharing. What's been interesting about the pandemic is everybody's numbers are out there for everyone to see. So if you were asking for something, you could quickly ascertain if that was a true need or not. And I think that's a good thing. I think it's good that we're sharing my colleagues across the industry. I mean, the fact that in the middle of all this, and I'm sure everyone listening or on the call can attest, people picked up the phones and helped, and each other and others. And, I can't help you, but I know someone who can, or can you help me? I can't help you with that. And we talked about it and we figured it out. And that is why I love the supply chain, and that's why I love our world, even though it can be crazy, because that kind of partnership and collaboration is now happening on a much larger scale. And I think it should continue. It really, putting the resources where it makes sense, and spending your time on your strengths and letting someone else help you where you may need some help. And and giving these opportunities like that local manufacturer I brought up, I would have never thought to call, and they live a quarter mile down the road from me. And so those kind of partnerships and open up the doors for others to start them, so we don't look the same. And I'm with you, Dee. I hope we don't look the same.
Thanks, Andria, and thanks for your participation today. Regine, any closing comments you'd like to share?
Certainly, I would agree that we should not. We should challenge ourselves to definitely come out of this different people in a way that really allows us to lead differently and look at things differently and really learn about the art of collaboration in a different way. So to me, when I think about what's happened in the past 7.5 weeks now, it's really the art of communication is key. And making sure that you build resiliency across the board and with yourself and with your team, create transparency. We didn't get a chance to talk about, self-care, because that's also really important as we go through this, as some of us have gone through this. There's been a lot of stress, a lot of things, not only on ourselves, but our team members. And so just really important to remember what matters most and to keep the true north always, present. So, yes, we're taking care of those patients. We're taking care of our caregivers, because that's who we are. We are those facilitators, that make sure that they have what they need. But also, very importantly, we need to make sure that we're taking care of ourselves as well, and that we're kind to each other. So when it comes to that collaboration, I think it's key, not just within an organization itself, but outside the borders of the organization, with those whom you know, with those you don't know, and across the board as a supply chain community as well. Like I said, I'm very, very, very biased when it comes to the supply chain, because we're called to stand in the gap and lead with conviction, calm, and compassion.
Absolutely, Regine. Amen to that. That was well said. Thank you. And a big shout out and thank you to our AHRMM staff, Debbie Sprinzinis for her leadership, Shana and Melissa on helping us behind the scenes here today, Andria, Regine, always a pleasure, and of course our own Mike Schiller for all the work he's doing on behalf of AHRMM. I hope you'll stay tuned and join us again for our next podcast or webinar that'll be coming up and advertised shortly. We're going to keep these going because there's a lot happening in advancing supply chain and healthcare. Thank you all. Take care.